Dr. Becky Spelman. I'm a registered psychologist and I'm the founder of Private Therapy Clinic. One of the things that we specialise in the most at Private Therapy Clinic is autism assessments and treatment for both young people and adults. So when we're working with young people, there is a team of people that are involved in the assessment. So we use a multidisciplinary team of usually about 3 people to be able to get an extremely accurate assessment. Now, at other places, sometimes corners are cut, sometimes only one practitioner is used, but when it comes to assigning such a serious diagnostic label that is really going to impact the rest of a child's life, we want to get this right. And that's why we use 3 people, 3 practitioners who are qualified. They come together as a team and they discuss the findings. So they work on different parts of the assessment process and then they meet together to discuss the case before they all agree on the diagnosis. So those 3 people have to agree together that yes, a diagnosis of autism is accurate. There's a few different steps involved in assessing a child. The first step is speaking to the parents at length about the child's early upbringing, their development, the milestones that they reached and at what time they reached those milestones. So we're really looking at learning about the child, where they were delayed in their development, and this helps us build a picture as to whether they might have autism. We're also finding out from the reports of the parents where the child is at right now and where they have limitations. We're particularly curious about their ability to understand things, to build friendships, how are they getting on in an academic setting, and where do they excel, where are their talents, and where are they actually doing really well in life, as well as where are their deficits. We also rule out other things such as trauma, other differential diagnoses such as ADHD, or other reasons why the child might not be performing to where they would be expected to perform. So then we speak to the school, or we collect information from teachers or relevant people who have contact with the child in school. We're also open to looking at other documents, other reports that have been done by other psychologists or other experts before coming to see us. We then spend an hour with the child doing the ADOS assessment, which is the gold standard assessment for children in the UK when we're assessing for autism. This assessment is quite fun, so we make it quite fun for the children in that we use a lot of toys, we do it all through play, and through play we're scoring the child on various different aspects, various different skill sets, various different types of understanding that they have or some limitations, but all guised in a way that we're playing with the child using lots of interesting tools and techniques and lots of toys, so that actually we're trying to make it as fun as possible for the child while also scoring them, so that we're looking at making this a very measurable process, so we really see how the child scores, so then we can make sure that we're getting the diagnosis right. We then have 3 practitioners coming together. So the 3 practitioners will have done various different parts of the assessment process. They will all have had contact with the child, with the parents, with the school, and then they're coming together to agree together on the diagnosis. So this is very important at Private Therapy Clinic because we really meet the gold standard for making sure that the diagnosis is accurate. Now, diagnosis can be a somewhat subjective thing because it's not uncommon for 2 practitioners to disagree about a diagnosis, and therefore we have a dilemma, and we want to make sure that the discrepancy between one practitioner's opinion and another practitioner's opinion is very, very limited. So we want to really explore beyond any reasonable doubt that this child absolutely has autism spectrum disorder. It would be very difficult if someone was assigned a diagnosis and then it's later found that actually something else was responsible for their difficulties, such as trauma. So therefore, the possibility of the diagnosis being accurate when 3 practitioners are coming together who are highly experienced, highly qualified in assessing for autism, if all 3 are agreeing on the diagnosis, then the room for error is very, very minimal. So this, as you can imagine, is much more accurate than when just one practitioner is coming up with the diagnosis. So we use the gold standard of the multidisciplinary team to assign autism spectrum disorder diagnosis across Private Therapy Clinic. And that's if people really want to have the gold standard assessment. We're not a clinic who is trying to get as many customers through the door as possible in order to make as much profit as possible. We are very much a bespoke service where we want to give quality to the individual. We want to build a relationship with the individual. So if there's any doubt or any questions after the assessment, you can just pick up the phone and have a conversation with us. You can ask us about areas of your report, why we've recommended certain things, or why we have concluded the diagnosis that we have. If there's any confusion about anything in the report, you can always call us afterwards and we'll be available to have conversations with you so that you really know the implications of that report. Because receiving an autism diagnosis is a pretty serious diagnosis. You will have that diagnosis for life, and you want to be confident that we have reached that conclusion prudently, that we have made sure that without any reasonable doubt, this is an accurate diagnosis. We pride ourselves on trying to be the best company in the UK for helping people with autism, because this is a matter that's very close to my heart, and we want to make sure that we can help as many people as possible, but in a really high quality way where people feel that actually connecting with us has had a huge impact on their life and hopefully even changes your life. So if you're interested, let's get the conversation going so that we can tell you a little bit about how we can support you and so that we can understand where we can best meet your needs.